Welcome. I'm nationally certified health and wellness coach Benita Zahn. Nearly 7 million Americans are living with Alzheimer's disease. That's the figure from the Alzheimer's Association. And that number keeps climbing as our population ages. By 2050, it's expected 12.7 million American adults will be diagnosed with Alzheimer's, the sixth leading cause of death. Now, it may sound odd, but despite these statistics, there's been no better time to get a diagnosis of Alzheimer's. And that's because diagnosis can be made earlier than ever. Add to this interventions that are having an impact, and research is booming. Here to discuss all this and talk about ways to protect your brain's health are Dr. Richard Holub, a neurologist with the Alzheimer's Disease Research Center in Albany, and Dr. Robert Holub, who recently joined his father in practice. And let me note that Dr. Richard Holub has conducted more than 134 clinical trials in Alzheimer's treatment and played a significant role in the investigation of all 5 drugs currently green-lighted by the FDA. So, gentlemen, welcome. And let's start, in a sense, with the really headline news of the day. It's the blood test to diagnose Alzheimer's. Give us a sense of what it's looking for and why is this so important?
Well, we've been trying to diagnose Alzheimer's disease clinically for 100 years. And until recently, it was only able to be clarified at autopsy, which is hardly acceptable in clinical modern medicine today. Science has been expanding and moving very rapidly, and we began to identify amyloid, which is important for the development of Alzheimer's disease as a toxin, to have gotten into the bloodstream, and we've been able to, with a simple blood test in clinical research, identify amyloid and therefore can tell if someone has an Alzheimer process even when they have no symptoms or very mild symptoms.
So amyloid would collect in the brain and that begins to impair cognitive function?
Yeah, it begins to accumulate 10 to 20 years actually before we have any symptoms. So by the time we get symptoms, this process has been playing for a long time.
So why is it such a game changer? Besides the fact that now you can get a definitive diagnosis and know exactly what you're dealing with, but in terms of beginning the treatment, if somebody is can be concerned.
Yeah, so I think what these tests have really enabled us to do is to catch people earlier than we've ever caught them before. By catching people years potentially before they develop symptoms, we can now pair them with potential treatments to either prevent or slow the disease altogether. And identifying those patients before they have severe impairments and are having larger issues is really what has propelled the research forward.
So let's then sort of tag on to that. In terms of knowing this, how does this then feed into hope for new treatment?
So I think that by identifying people early who are having what we call the Alzheimer's process going on and pairing them with these potential treatments, it allows us to slow the disease or stop the disease earlier, knowing that later on the disease gets worse.
There is no cure at this point. I mean, let's be clear.
No, and I'm not sure there's ever going to be a cure per se in the usual sense of what the word cure means. It's very hard to reverse the damage that's been done. Perhaps we can reverse some, but the most important aspect of this is we've discovered that the best way to approach Alzheimer's disease is prevention. And of course, there are many lifestyle activities in which we could engage to help with prevention, but in terms of pharmaceuticals and developing drugs for research, the goal is going to be to identify people before they have symptoms and treat them to prevent the clinical appearance of the disease. So that's where we're going.
Of it.
Yeah.
Yes.
Right. So the 5 drugs that have been given the okay by the FDA, give us a thumbnail sketch of how they work.
The earlier drugs that we've had approved, like Aricept, galantamine, Exelon, memantine, et cetera, they're symptomatic medications. They may give some modest visible improvement, but they don't change the course of the disease. We've had more recently 2 additional drugs FDA approved, which are anti-amyloid drugs, and they do have some efficacy, but they're associated with some potentially significant side effects, which becomes problematic.
I just had a conversation with a fellow whose wife is progressing through the disease, and one of those drugs they said she can't possibly take because of a bleeding concern. Do you want to address, so who is and who isn't a candidate for these 2 new drugs?
Right. It's a really important point, is that while these drugs are the first things that have ever actually slowed the progression of the disease, before this, we never had anything that really was disease modifying, as we call it. And so I want to make sure we give due credit. These are the first time we've really touched the disease. But they only slow the disease by about 20 to 27%, which in real world terms translates to an average of maybe 10 months longer of independent living, which is, again, better than anything we've ever had, but clearly there's still a long way to go. And the caveats to these treatments are that if you have certain genetics, which we'll get into, but if you have a certain genetic type, it's really a lot less safe for you to take this because of risks of brain inflammation and bleeding. If you're on blood thinners, which a lot of people in our population are, you can't really have these at all because of those risks being so heightened.
And that was the concern for this particular woman. Right. What are the names of these 2, the latest drugs?
It's lecanemab and donanemab are the generic names for those medications.
Is insurance covering this stuff?
Partially.
And that becomes a problem too.
Yeah, in addition to the cost of the drugs, which is not insignificant, they require safety MR imaging at regular intervals. They require other monitoring visits, additional visits to the neurologist. They involve intravenous infusions at an infusion center or a hospital, and the nursing that goes along to it. So it does add up to a very costly intervention.
But it's exciting news. Nonetheless, it begins to open the door, pave the way for
absolutely.
further.
It's the first time we've been able to modify the disease, and now we know for sure that we can.
Right.
And that speaks also to getting the diagnosis at an earlier time. And in fact, we're going to take a closer look at younger people who are coming in for screening and what that could mean for their future when we come back.
Word finding trouble? Forgetfulness?
Is it Alzheimer's or just normal aging? I'm Dr. Robert Holub. For over 15 years, I've helped patients navigate these exact questions.
Hello, I'm Dr. Richard Holub at the Alzheimer's Disease Research Center. For over 35 years, I've been working toward a cure.
Early detection remains critical. If you or someone you care about is experiencing memory problems, call today for a no-cost memory screening.
Welcome back. In an earlier conversation I had with you gentlemen, we were talking about the fact that younger people than ever before are coming in for screening for Alzheimer's. Why? And then what's the impact of that?
Yeah, so we have people coming into the office now starting at age 50. These might be people who have a family history. Maybe they found a genetic result on 23andMe, or are just worried that they may have noticed some mild changes in their own thinking where they're repeating words, or they have a word on the tip of their tongue and they can't think of the right word in enough time. A lot of stuff that might have been used to be called normal aging, but now we know a lot of people it's not normal aging.
And what impact does that have? I mean, really, why does it matter if they come in earlier?
Yeah, so what we found is that really time is brain. So by diagnosing these things as early as possible, we give our potential treatments a lot more chance to work to try and slow or prevent the disease altogether. Now, the later you go, even before the past 5 years, most of our patients were a lot worse off. We were saying that you had to have they were carried and brought into the clinic, not walking in of their own accord.
That's true. That's true. They always needed someone, which today we call a study partner, but back then we would call the caregiver, who would escort them in, tell them to turn left or turn right, and to get them into the building. Now, people drive themselves, and they jump up into the office and get seen.
When we first started, you mentioned 23andMe, when tests like that hit the market, there was a concern that people would get this genetic information that may not be exciting to hear in a positive way. And then what would happen? What would they do? How would it impact their life? Might it have a negative impact? What's the research finding when somebody finds out genetically they may be predisposed to developing Alzheimer's?
Most people who are interested in genetics, in their personal genetics, think through that before they have the test. There are people who say to themselves, I don't want to know. Often they change their minds later, and they change their minds as they begin to hear more and more about research in Alzheimer's disease and how things are moving forward, and that there are things that can be done.
And we're going to delve into prevention in the next segment, some things that will help keep our brains healthier. I think in our conversation, you talked about people learning this information and then discarding it.
Right. There are some studies to say that most people, when they learn a genetic result within a year or two, completely forget that they ever learned it in the first place. But for those people that do remember it, we have seen that it can be very empowering.
And let me just jump in. They don't forget it because they have Alzheimer's. They just put it out of mind.
They just forget it, yeah, because it's not something they're affecting their daily lives, and so it drifts away.
So there's APOE 1 or 2 and 3. There's a couple of APOE genes.
Yes.
Talk about these and how they impact the potential expression of the disease.
So there's a risk factor called apolipoprotein E. It was actually discovered by cardiologists when they were looking at cholesterol and fats, and it turns out to be a repair factor in the brain and has multiple other functions in the brain. And there are 3 variations of this gene in humans, and one is ApoE2, which is actually protective against Alzheimer's disease. Unfortunately, it's the rarest form. Then there's ApoE3, which is the most common and confers an average risk of Alzheimer's disease. And then there's ApoE4, which confers an increased risk to Alzheimer's disease. And
I just want to jump in. These are genetic defects, if you will.
Variations.
Variations. You're born with them.
Yes.
It's not something that happens because you turn 50 or 60 or 70.
Correct.
The expression of them may become obvious when we age.
Well, I guess we like to say that with the genetics, it's by no means, very important to know, but by no means a guarantee that you're going to get the disease. Even with the hardest genotype, which is called ApoE44, it gives you about a 55 to 65% lifetime risk of Alzheimer's.
And you have to get one of these from both parents.
You get one from each parent, but even then, that's not 100%. And that is based on current average lifetime. If we all lived long enough, we'd probably all get Alzheimer's eventually. But it's a risk factor, and of the total gamut of Alzheimer's disease. The genetic subset is probably about this much, and the lion's share is still what we call de novo. It just happens. It's bad luck. It's aging over time. Aging
over time, but not genetically affected.
Not
Very
that
interesting.
directly. Right.
So then we come down to how do you protect what's going on inside your brain? We're going to talk about that right after this break.
A lot of people have Alzheimer's. Some know it, some don't. Some are in denial, but they don't know where to go or what to do. And this will help them understand where they are, why they're there, what can be done, and it also can educate their caregivers as to what they can do to help. Being there gives me confidence to be out as an Alzheimer's person. It's just a pleasant place to be.
Welcome back. Everyone wants to know about prevention, what does and doesn't play a role in keeping our brains healthy. So let's get into that conversation there. And I want to start with something that's gotten a lot of attention in the news. Hearing impairment, and that raises your risk for Alzheimer's disease. So if you have the genetic predisposition, it encourages it to show its face. Is that right?
Whether you have the genetic predisposition or not, yes, hearing impairment can have a lot of ripple effects. It can affect our socialization. It can affect our mood. When we don't hear well, we withdraw, we can become depressed, and we've seen that down the road this can predispose to Alzheimer's regardless of your genetics.
So you can get Alzheimer's disease even if you don't have the gene for it?
Absolutely.
Absolutely.
Because of other things we're going to talk about in the prevention. Right. So hearing is very important.
It is.
Which, as you pointed out, then talks about socializing. Some people are just not geared that way.
Socialization makes a big difference. It's very, very important. Now, people, by the nature of their personality, socialize in different areas, but the interaction among people is very important. And we always felt that it was a part of the human condition in a more of a psychosocial sense, but more recently science has been revealing that there are changes in our biochemistry that occur that affect certain molecules like interleukin-6 and others that move these things in a direction that are toward healthier and longer living.
So what does socialization mean? Do I have to have a card game every week, or can I just go take a walk and smile at the neighbors?
Yeah, I'd say it usually means a level of meaningful interaction. I like the card game. That one sounds good to me. I think where you're talking and interacting one-on-one with other people, and even the most introverted people among us, we still need that little bit of socialization to keep us going.
So card games you like. Let's talk about the so-called brain games. I'm a Wordle devotee, and connections and a friend social interaction. We send our results every day to each other.
Right.
So I score 1 for social interaction?
Absolutely.
Does that work?
Yeah.
So even if we're interacting socially virtually, that's okay.
I wouldn't say that it replaces true human direct social interaction. I would say that having some virtual interaction is definitely helpful, but I wouldn't say it replaces it.
Okay, so let's talk about
particularly for somebody you know well.
Yeah.
Yeah, you know,
Right.
that's.
So let's talk about brain games, crossword puzzles, Wordle, fret words with friends, Sudoku, all those things. Do these mean anything?
So we just have seen that the more you use your brain, the longer you keep it, the less you lose of it.
There's this sense that, and findings that in the brain, there are these molecules called neurotrophic molecules. They're neuroprotective parts of brain function. And these neuroprotective factors increase with social interaction. They increase in the brain with the use of your brain, with keeping your brain active in multiple areas. They increase with exercise. So we have an increase in protective factors in the brain with all of these elements.
Diet. Does obesity play a role in negatively impacting our cognitive abilities as a healthy, Mediterranean diet, plant-based diet? Are these better for our brains?
Yeah, so what we found is that a sort of modified Mediterranean diet tends to be associated with the best brain health down the road. There's a lot of speculation as to why that may be, but across the board, that's what we've seen. And while I wouldn't say that obesity itself is necessarily directly predisposing to Alzheimer's, we know that the things it can contribute to, high blood pressure, diabetes, high cholesterol, heart disease, vascular disease, these are things that over time do directly affect our rate of getting Alzheimer's disease.
So an appropriate diet helps us. Exercise. Somebody is going to say, how much of it? Do I have to run a marathon, or can I walk 3 days a week?
We actually have an answer for that one, fortunately. So the best current sciences as of now is about 2.5 hours of some good cardiovascular exercise over the course of a week. Now, that doesn't have to all be at once. It can be broken up into little 10 or 5-minute segments. They've actually studied this.
Exercise snacks,
yeah,
I'm a fan.
Exactly. Or it can be done, as the weekend warrior once a week and you get it. But when you get that much exercise, it has a lot of benefits for your cardiovascular health. And this doesn't have to necessarily mean running on a treadmill or out in the street. This can be doing, some good yard work, just where you get your heart going and get a little bit of sweat on.
And
that counts.
Then you get to forest bathe too, which means getting out in the green.
Yeah.
Some great stuff to keep in mind. Now, when we come back, we're going to introduce you to a special local woman and share her journey with Alzheimer's disease, the research center these gentlemen are involved in. We'll be right back.
Hello, I'm Dr. Richard Holub.
And I'm Dr. Robert Holub. We're with the Alzheimer's Disease Research Center.
If you or someone you care about is experiencing memory problems, we have appointments for a no-cost memory screening.
We've been talking with the doctors about the work ongoing at the Alzheimer's Disease Research Center on Madison Avenue in Albany. Now we're going to share the story of a local woman who lost her mother to Alzheimer's and share her personal journey participating in a research study.
Well, my mother was the smartest woman I ever knew. For years, I just couldn't understand why she didn't remember things anymore. It was a difficult time. She didn't know who she was or where she was. She ended up dying of Alzheimer's. I wanted to do anything I could to help people in the future. I asked my doctor for a reference, and he recommended Dr. Holub, and I have been so grateful ever since. Both doctors and every person there is so kind and helpful, making you feel comfortable and at home. I would recommend it highly. No one ever looks down on you. They're always smiling. They're always grateful to see you. It's just a pleasant place to be. Being there gives me confidence to be out as an Alzheimer's person. I get up and have some coffee and I do the puzzles to stimulate my brain. I do the jumble, the Sudoku, the crossword, and the questions. My husband and I do those together. That's kind of fun. That's my brain work in the morning. It keeps me sharp. It reminds me of things as I'm doing it, making mental connections. I used to teach math and I used to teach English, so it comes together. I think some people don't want to admit that they have Alzheimer's, that they may feel that it's a stigma, and it's not. Trials like this are important because a lot of people have Alzheimer's. Some know it, some don't, some are in denial, but they don't know where to go or what to do. And this will help them understand where they are, why they're there, what can be done, and it also can educate their caregivers as to what they can do to help. I would recommend Dr. Holub's office because everyone there, no exception, is kind, welcoming, helpful, non-judgmental, there to be of assistance to you and to help you in any way they can. It's just a positive feeling. I would recommend that you go there and see how you could be treated.
It's a powerful story and a testament to the work that you doctors are doing. So let's get a little more about the research that you're involved in. And first, who can partake in it?
We're looking for people who have early signs of changes in their memory and cognition to people who are concerned about their memory and cognition, maybe without any real specific symptoms. All of this is evaluated when they come into the office, and we get an idea if their symptoms are zero, minimal, mild, and then we're able to see if there's a research program that might fit them. We have multiple programs, about 12 running now, multiple that we're actively recruiting for, and some programs might look for a patient who tests well to this level or to this level or to this level, so the patients will get allocated to one particular program or another.
That opens up the door to two questions. The first is, do you have to have a doctor's referral to come to be tested, or can you self-refer?
Fortunately, no, you don't need any referral. There's no insurance involved. You don't pay anything. You can just call us and we can get you in, and quickly as well. I think that's something we've noticed is that it can take a long time with our healthcare system these days to get neuropsychiatric testing or to see a neurologist, often on the order of years. And we can get people in within a few weeks, fortunately.
Which is so important, as you've been stressing during this half hour. Yeah. Time is brain.
Exactly.
You know.
I should mention that all this is possible now. We used to do 1 program, 2 program, 3 program. Now we have 12 active programs. And the reason for this is there's been an explosion in science that has started elsewhere in medicine, spread to oncology, and is now spreading into neurology, where we're able to identify biomarkers that tell us if someone has a disease. They can be used to tell us how a disease is progressing or maybe remitting under treatment. And it's enabled us to look at multiple potential ways to attack this disease. If you're a hunter, you may have a rifle, a bow and arrow, a tomahawk, and in this kind of research now, we have multiple targets that research may demonstrate treatments that may actually make the difference.
Yeah. You were saying you've got 12 studies that are ongoing now. Do any of them involve drugs that are prescribed for the research participants?
The different treatments that we're studying, they can be given as an infusion. Some are given as a pill. The infusion might be once a month. We give them in different forms. Some are subcutaneous, and it just depends on the study and the specific drug that's being studied. But there's a variety of drugs and ways of delivering them that we give access to through our trials.
Where are you along? Are these phase 3, where you're really looking at dosage?
We cover the gamut. As we're finishing the studies for some programs, the 2 that have been approved that we talked about earlier, lecanemab and donanemab, those, even though they're FDA approved, they're patients who started in these programs 4 years ago, and they're still involved in these programs because we're learning more. So even though the drugs are approved, the patients who've been in research, many are staying in research because they want to, and it also provides us with more and more information.
We wrap as we started. This is a very exciting time in Alzheimer's research and in treatment. If there was one thing you wanted to leave folks with, what thought would that be?
I would say that there's hope, that now knowing and having that knowledge is power, and that we can now act on that, and that there's hope there. That's the biggest message.
The more we know about ourselves, the better we'll be able to take care of ourselves and walk into the future.
Eat, drink, move, socialize, do it all with forethought.
Yeah.
Absolutely.
Be involved. Guys, thank you. Thanks so much to Dr. Richard Holub and Dr. Robert Holub, who are both with the Alzheimer's Disease Research Center in Albany. And if you're interested in a memory screening at no cost, don't hesitate. You heard them say that. Reach out. And you can call at 518-426-0575 or visit the Alzheimer's Research Center, albany.com. Do it for your mind and your peace of mind. I want to thank you for joining us. I'm Benita Zahn. Be well.
Word-finding trouble? Forgetfulness?
Is it Alzheimer's or just normal aging? I'm Dr. Robert Holub. For over 15 years, I've helped patients navigate these exact questions.
Hello, I'm Dr. Richard Holub at the Alzheimer's Disease Research Center. For over 35 years, I've been working toward a cure.
Early detection remains critical. If you or someone you care about is experiencing memory problems, call today for a no-cost memory screening.